Good afternoon and welcome. I'm your moderator, Ronald, Donnell, clinical professor and psychologist at Arizona State University's College of Health Solutions. I'm a faculty in the Doctor of Behavioral Health degree program focused on integrated healthcare, the team-based coordinated treatment of physical and mental health problems using behavioral interventions. My focus is global integrated health, conducting research and workforce training in China, Southeast and South Asia, and Africa. I'd like to thank you for joining our Health Talks webinar, brought to you by the College of Health Solutions at Arizona State University. Our college works to address the challenges facing people and communities to stay healthy, improve their health, and manage chronic disease. These Health Talks are one way we serve the community with timely and relevant educational information that also provides continuing education credit at no cost. Before we begin, I have a few quick housekeeping items. First, the session is being recorded and will be posted on our website, asuhealthtalks.com. After the main presentation, we'll have about 20 minutes of Q&A. Please submit your questions via Zoom's Q&A feature and not in the chat box. Regardless of whether or not you've requested CEUs, please register your attendance using the self-check-in link posted in the chat so you have an accurate record of who attended today's webinar. Finally, for those of you who are attending live, we'll receive a brief survey asking for your input about today's webinar. If you're interested in receiving continuing education credits, this must be completed prior to receiving credit. If you didn't apply for CEUs, we still appreciate your feedback to help improve our series. I'm so excited to introduce today's speaker, Ann Sebren. Ann's a teaching professor in College of Health Solutions Career Track Distinguished Faculty. Her primary teaching areas focus on the science and practice of stress management and regulation, with an emphasis on mindfulness-based programs and practices for reducing stress, enhanced well-being, and health behavior change. She's a certified mindfulness teacher professional and International Mindfulness Teacher Association. She's been teaching mindfulness at ASU and in the community for 15 years. We're so fortunate to have Ann with us today as we explore mindfulness-based interventions for clinicians, stress, and burnout. Clinicians and healthcare providers face daily demands and increased stress and risk empathy fatigue and burnout. Today we'll address the latest evidence on the role of mindfulness-based practices in supporting clinician well-being and discuss research on the impact of mindfulness across multiple dimensions of burnout, recent neuropsychological findings, distinguishing empathy from compassion, and their relevance to empathy fatigue, and the growing evidence for cultivating self-compassion through mindfulness as a protective factor against burnout. On a personal note, I've been practicing mindfulness for about 10 years. I provide education and training on mindfulness to clinicians in China, Southeast and South Asia, and more recently Africa. I know that mindfulness is key for managing my stress and burnout and living life with joy and compassion. I'd like to please welcome today's presenter, Ann Sebren. Thank you, Ann.
Thank you so much, Ron, and thank you all for being here today.
One more thing, if you haven't done so, please register your attendance now using the self-check-in link in the live chat. We have record of who attended. Thank you, Ann.
No worries. Okay. So again, thank everyone for being here. So today I am going to talk a little bit to begin with about what we mean by burnout and describe in a basic way what we mean by mindfulness and mindfulness-based interventions, and then take a little deeper dive into how these types of practices might impact stress and burnout through emotion regulation, through attention monitoring and acceptance skills, the role of compassion and empathic distress and self-compassion. And then I'll just touch a little bit on mindfulness-based micro practices and offer a few resources. So when we think about what we mean by burnout, the World Health Organization defines burnout as a syndrome conceptualized primarily as a result of chronic workplace stress that's not been successfully managed. So it's specifically a phenomena in a workplace context and is not really applied to our experiences in other areas of life. And it's been characterized by three dimensions. The first dimension of burnout is emotional exhaustion. That's that feeling of energy depletion, fatigue, debilitating fatigue, the inability to face work demands, and the inability to support those, particularly in the helping professions that we're charged to care for. The second domain of burnout is cynicism, or what's sometimes called depersonalization. This is that mental distance from the job, right? The feeling of negative, feeling negatively about the job, a disengagement in a way from the job. And it can be characterized by irritability, the having negative attitudes towards our colleagues, and even negative attitudes towards those that we're charged to care for. And finally, the third dimension of burnout is a sense of reduced personal accomplishment. This is a sense of ineffectiveness, right? A sense of being less productive, low morale, that sense of not really being capable of helping those that we want to help, and that the feeling of just not being effective. This will not be surprising to any of you, but the prevalence of burnout is highest in the helping professions. This includes clinicians in healthcare settings, but also teachers, first responders. And interestingly, the term burnout was first used in 1974 to describe the exhaustion that even then was being observed in people in the healing professions. And some of the most recent data on US clinicians suggests that 45% of respondents experience at least one of those symptoms or in those domains of burnout. Now, clinician burnout is really complex and involves a lot of different factors, right? It involves, it comes from both institutional and individual factors that create this imbalance between our job demands and the resources we have available to respond to and meet those demands. And these types of factors include, right, high workload, long hours, the piling up of administrative tasks, particularly among clinicians. There's some recent research that has pointed out the impact of the electronic medical records on the increase in cognitive load and the role that that's playing in the increase in burnout. Staffing issues, lack of control over the work environment, right? Chaotic cultures, the disconnect between our own individual values and sometimes the decisions we have to make that are being driven by institutional factors, right? There's a lot of uncertainty in clinical work, and there's a role of empathic distress. So addressing burnout requires both systemic and individual level interventions. So mindfulness-based interventions may be useful for helping individuals prevent, mitigate, reverse symptoms of burnout, but they should not be seen as shifting responsibility solely to the individual for their experience of burnout, right? And there's some research that suggests that these types of mindfulness-based interventions are more effective when they're provided by and supported by the institution. They're supported at an institutional level as part of a larger culture that values the well-being of clinicians and healthcare providers and healthcare workers. So what do we mean by mindfulness-based interventions? Well, first, let's make sure we're on the same page in terms of what we mean by mindfulness, right? This is one of those words that's ubiquitous, right? It's kind of everywhere these days. This is probably the most common definition of mindfulness that you'll find in the literature that's rooted in Jon Kabat-Zinn's original definition of mindfulness that originated back in the 1970s with mindfulness-based stress reduction. Mindfulness is the awareness. So stop right there. Mindfulness is a quality of awareness that comes from paying attention on purpose to our present moment experience, our momentary experience, moment by moment by moment, with a quality of non-judgment, which means a sense of non-reactivity, a non-contentiousness with what we're contacting in our experience, being open and receptive to what is present in our momentary experience. And when I teach mindfulness, I usually add this last piece to the definition. Because why do we want to do that? Why do we want to pay attention to our present moment experience and cultivate this capacity for non-judgment? We do this in order to reduce reactivity, reduce our habits of reactivity, and enhance our capacity for wise, caring response. So we can place the cultivation of these skills in a larger context. So when we think about what we mean by mindfulness-based interventions, in the research literature, the gold standard, if you will, of mindfulness-based interventions is the Mindfulness-Based Stress Reduction Program, MBSR, which is a standardized curriculum of over 8 weeks that involves meeting for 2 hours a week or so with quite a bit of home practice in between each session. There are still a number of abbreviated adaptations of MBSR that have been included in the research literature that include shorter sessions, fewer weeks, shorter home practice. And there are other types of mindfulness-based interventions that have at their core this same training in mindfulness skills. So for example, compassion cultivation training, training the skills of compassion, but with a mindfulness training at its core, and also mindful self-compassion. And there's some emerging programs on positive emotion skills training that can be found in the literature that also include some element of mindfulness and compassion training. The more recent evolution in these types of interventions is the delivery of these interventions in a digital way, right? This could include hybrid programs, meeting live for a short time, and everything else is self-paced online, the use of apps, podcasts, the provision of website resources. And these types of interventions usually involve much shorter sessions. They can vary in length, but they include much shorter practices, including an increased use in micro practices, which we'll talk about a little bit later. So what is it that happens in a mindfulness-based intervention? Mindfulness-based interventions generally include learning specific formal mindfulness practices, such as sitting with awareness of breath, awareness of bodily sensations, awareness of sound and hearing, but also the awareness of the moment-to-moment experience of one's thoughts and emotions. Practices such as the body scan for enhancing bodily awareness. Practices such as mindful walking or mindful yoga, gentle stretching, loving kindness and compassion practices for self and others. And also some daily activity practices such as mindful eating or mindful communication. Almost all of these types of interventions include an informal mindfulness practice, like short practices in daily activity. These programs often include a component of psychoeducation, learning about the physiology and psychology of stress, the science of mindfulness, about coping and strategies for coping. If it's a group-based intervention, there's usually time for some group inquiry and dialogue and reflection. And if it's a multi-week type of experience, there'll be home practices in between each session. So if we look now at what these types of programs or the effect these types of programs might have on burnout, particularly in a healthcare or a clinical environment, we can look at a number of meta-analyses that have been done. Now, there's lots of meta-analysis that have been conducted on the effectiveness of mindfulness-based interventions for a broad range of outcomes. But you have to be a little bit careful when you're looking at the meta-analysis literature on mindfulness, because you have to read carefully what types of interventions are actually being included in the meta-analysis. Because you can find meta-analysis that have been done that include an 8-week intensive mindfulness training experience alongside music therapy that's included in the data analysis, music therapy with awareness of breath, or a short, 3-hour intervention to learn some basic mindfulness skills. So, right, so there's not a lot that can be drawn. But if we look at some of the stronger meta-analysis that have been done, that have been limited to mindfulness-based stress reduction or adaptations of mindfulness-based stress reduction, and we look at the primary outcomes in that burnout inventory, those 3 domains of burnout, we see that mindfulness-based interventions have been found to have small to moderate effects on the global score of burnout, which is a meaningful effect. But perhaps one of the most interesting meta-analysis that I've run across in this area is the analysis of mindfulness-based interventions limited to MBSR and those types of adaptations on each burnout domain score in primary healthcare providers. And when we look at the effects of mindfulness training on burnout, we see that in many ways, the impact might be greatest on emotional exhaustion, right? A moderate effect on reducing emotional exhaustion, but still positive effects specifically on reducing cynicism and reducing lowering that sense of reduced personal accomplishment or enhancing a sense of personal accomplishment. Now, if we look at the changes in the burnout scores, the authors of this meta-analysis identified these score changes as clinically meaningful because they were referring to data that indicated that a 1-point increase in these burnout domains, a 1-point increase in exhaustion or cynicism or reduced accomplishment, has been found to be associated with reported suicidal ideation, reported medical errors, and reduced working hours. So even these moderate changes in burnout scores are probably clinically meaningful changes. So let's explore in a bit deeper way now. How might these types of mindfulness-based practices make a difference in stress and burnout? So I want to talk a little bit about the role of these practices in emotion regulation, the role of these practices in empathic distress, and the importance of compassion and self-compassion that is grounded in these basic mindfulness skills. 2 of the primary mechanisms that have been identified that underlie the positive outcomes that have been associated with mindfulness, and 2 of the primary skills that are trained or cultivated in mindfulness training are attention monitoring and acceptance. This is rooted in the monitor and acceptance theory by David Cresswell and his laboratory. And these 2 skills, these 2 capacities are distinct from one another, but they are synergistic and they are both necessary. Now, if we think about attention monitoring, what do we mean by that? Attention monitoring is our ability to self-regulate attention, to orient our attention toward our present moment experience, what sensations we're experiencing, what mind states we're experiencing, what thoughts and emotions are present in our moment-to-moment experience. And when we're engaging in pretty emotionally neutral tasks, right? Being able to focus our attention and regulate our attention on our own experience actually appears to contribute to better cognitive function. But when we are paying attention to our experience in more emotionally intense contexts, right? Paying attention to our present moment experience when there's higher intensity, it's more painful, there's more difficult emotions, and we're paying attention without acceptance. This actually contributes to being less able to regulate our own emotional experience and emotional response. It contributes to a greater experience of distress and being less tolerant of that experience of distress, which heightens our reactivity. And these contribute to that increased risk of depression and anxiety symptoms and more maladaptive coping behaviors. So if we look at this in the context of some of the work that's come out of Barbara Fredrickson's positive emotion laboratory at University of North Carolina, where she has explored the idea of the downward and upward spiral. In this context, paying attention to our momentary experience in highly emotional context without acceptance, this leads to a narrowing of our focus on our own negative experience. And the more our attention narrows to our own negative experience, the more likely we are to appraise the situation and our experience as stressful. And when we appraise the experience as stressful, we're more likely to experience negative emotions, which increases our experience of stress. This leads us to be more sensitive to the perception of threat in our environment. So our attention continues to narrow to negative experience. The more our attention narrows, the more likely we are to appraise the situation as stressful. And so on it goes. So we can very easily get caught in this downward spiral when we contact our experience without this component of mindfulness that we're referring to as acceptance. So acceptance appears to be the core factor in mindfulness practice in a way. So what do we mean by acceptance? This is a term that can sometimes evoke some misunderstanding or unhelpful connotations. But really what we mean in this context, it's the non-reactive lens through which we view our momentary experience. So in other words, in mindfulness training, what we're developing or cultivating is we're practicing and developing the skill of allowing experience to arise and pass, to come and go, without adding all of our narrative elaborations, the stories that we tell about what's going on and why it's happening, all the judgments and criticisms and analysis that we add to the experience. And so when we cultivate this capacity to contact experience and let the experience be how it is, to receive what's here because it's already here, to contact experience and allow the unpleasant to just be unpleasant, to allow tension to be tension without adding all of the narratives and judgments and criticisms, this is contributing to our ability to interrupt those automatic habits of reflective reactivity to unpleasant and difficult or painful or stressful experiences. Now, this is quite in contrast to suppression and avoidance. Evidence suggests that suppression and avoidance plays a significant role in increasing that domain of emotional exhaustion. And that's because suppression and avoidance requires a lot of cognitive and emotional effort that over time consumes our psychological and physical resources. And that paradoxically, even though we're suppressing or avoiding experience that is painful or unpleasant or overwhelming, the constant effort of trying to do that paradoxically actually leads to greater emotional intensity over time. But the data suggests that high levels of the combination of these core mindfulness skills, right, of attention, monitoring, and acceptance, enhances our ability to tolerate the experience of distress. So we're less reactive when we contact the experience of distress. And there's a good body of evidence now that these skills contribute to a reduction in rumination, right? Replaying uh, uh, thoughts, memories, narratives over and over and over again. And one of the ways that this has been identified is through the skills of being able to shift the attention away from these ruminative experiences to experiences that are more neutral or more positive, such as returning the attention to bodily awareness or cultivating thoughts of kindness and compassion, or changing our relationship with thoughts, right? That we let them come and go without getting hooked or getting entangled in the narrative, without getting all caught up in it and swept away in it. So this reduction in rumination is also a factor. This ability to tolerate distress, reduce rumination, also plays a role in the ability to be less reactive, and which opens the possibility of reappraising stressful situations, interrupting that downward spiral. And all of these skills have been found to be associated with reductions in depression and anxiety symptoms and a reduction in maladaptive coping behavior. This is particularly critical when we think about the role that empathic distress can play in burnout. Now, in the research literature, empathy has been found to be a protective factor when it comes to burnout. But there's a nuance here because recent research is suggesting that it may be the component of compassion or empathic concern that is the primary contributor to that protective factor for burnout. So if we think about the components of empathy, empathy can be can include the components of our affective empathy, our emotional empathy, our ability to feel what others are feeling. There's a cognitive aspect of empathy or perspective taking, our ability to take another person's point of view or their perspective. And then there's an empathic response that's part of empathy. And that empathic response can be empathic concern or it can be empathic distress. And the research in this area is both complex and limited. There's not actually a lot of research really identifying how each of these components of empathy might play a role in the various components of burnout. However, if we think about this distinction between compassion or empathic concern and empathic distress, we can think of compassion, and certainly empathy is a core motivation in the helping professions, right? It's a core aspect. So if we think about compassion, it's a feeling of concern for another's suffering combined with a motivation to help. And compassion is characterized by being other focused, right? Focused on the other's experience and the other's emotions rather than on one's own experience and one's own emotion. And part of the character of compassion is that it's accompanied by more positive emotions, like emotions related to love and connection. And so at the core of compassion is an approach and pro-social motivation, right? And which leads to better health outcomes. And that includes a reduced risk of burnout. Empathic distress, on the other hand, is really related to our empathic exposure without the ability to regulate our own emotional response, right? And this leads to empathic distress over time, where our focus becomes instead our own felt pain and distress in response to another's distress, right? And this leads to, quite naturally, a greater experience of one's own distress and a natural impulse to withdraw. So empathic distress has been found to be a core factor in the domains of emotional exhaustion, but also a factor in the rise in disengagement and depersonalization factors that is a part of a protective strategy. And part of what's going on here is that there's recent research that suggests that particularly this aspect of affective empathy, feeling what others feel, activates quite different neural networks than those involved in compassion. Affective empathy involves the neural networks that are related to our ability to monitor our own bodily states and our own emotion perception and processing. And this is what's underlying that shared emotional experience. In this case, the experience of pain and distress. And high affective empathy has been associated with an increase in burnout scores. So affective empathy, in the absence of the ability to regulate our own emotional reactivity, without these skills of attention monitoring with acceptance and non-reactivity to our own momentary experience, this is what appears to underlie empathy fatigue or empathic distress. What in the past has sometimes been called compassion fatigue, but it's more accurately empathy fatigue or empathic distress. Compassion, on the other hand, involves completely different neural networks. Compassion involves the executive function networks that are involved in regulating where our attention goes, regulating our response, both in terms of our behavioral response and our emotional response, so our self-regulation networks. And so the executive function networks are active in compassion, but also the neural networks associated with the experience of reward and the experience of affiliation. And a lot of this is, we can see evidence of the release of oxytocin, right? Or the bonding hormone or dopamine, right? For that sense of reward and affiliation that are part of that experience of the positive emotions involved in compassion. So this creates a more positive, calm response with that motivation to help. And recent meta-analysis that have focused specifically on empathic concern have found that compassion is correlated, significantly correlated with less depersonalization and a higher sense of personal accomplishment. And if we can think of compassion as the sensitivity to the experience of suffering, which includes the acknowledgement of the presence of pain, the acceptance that pain is present, and a motivation to alleviate that suffering. Self-compassion is that same compassion directed inward. And there is evidence that suggests that even this same compassion directed inward activates similar neural networks. So relating to oneself as the object of of care and concern when we're faced with our own experience of difficulty and stress and hardship and suffering. Kristin Neff, who originated this construct of self-compassion, rooted self-compassion in these skills of mindfulness, right? It's grounded, or it rests on the foundation of this capacity to regulate our attention to our moment-to-moment experience with openness, receptivity, non-reactivity, and non-contentiousness. But she added in this construct the capacity to offer ourselves self-kindness and to also rest in a sense of common humanity, to recognize that it's not just me, right? I'm not alone in my own experience of stress or difficulty or overwhelm. It's not just my failure, and right, that others too experience this. This is a natural, in a way, basic human experience. It's not just me, and I'm not alone in that experience. Low self-compassion has been found to be significantly associated with high levels of burnout, especially in the domains of emotional exhaustion and empathic distress. On the other hand, higher self-compassion has been found to be significantly associated with less exhaustion, less cynicism, greater job satisfaction, and more pro-social behavior. And again, if we look at some of the meta-analysis that has been done on self-compassion training, moderate to even large effects have been found on the reduction of burnout scores. So to summarize this fairly quickly, right? If there are work-related conditions that contribute to burnout, that lead to exhaustion, disengagement and cynicism, and less personal accomplishment, by cultivating the skills of attention monitoring and acceptance, we're enhancing emotion regulation and compassion. And these capacities that we can train and cultivate lead to more energy, feeling more connected and affiliated, and having an increased sense of both efficacy and personal accomplishment. And, right, particularly when we're talking about healthcare settings, even with this growing evidence that there's benefit for this type of training, there are barriers to the utilization of mindfulness-based interventions. The time constraints are significant and real. The demands, the high level of demand that are both at work but also at home, the unpredictability in work schedules makes it difficult to commit to a mindfulness-based program or a program for mindfulness-based training and cultivation right? Even if there's evidence of benefit, there's not time, there's not energy, the schedules don't fit. So we have to really consider that there are adaptations that are needed for these types of environments. And one of the emerging areas of focus has been on the inclusion of more mindfulness micro practices. And there's limited, but some emerging research that suggests that frequent short practices throughout the day can both enhance mindfulness skills and also result in some reported stress reduction. And indeed, these types of informal daily practices have been found to be a critical element that's associated with many of the positive outcomes in mindfulness-based interventions. So the idea here is short practices many times, short practices many times. And this supports our ability to integrate these skills of awareness and compassion, both for others and for ourselves, into our regular daily activities. So what are some examples of these types of micro practices? These include things like the stop practice, right? Just simply stopping through many times throughout the day to stop, feel the sensations of the breath, check in to observe what sensations are happening in the body, what's happening in my thoughts, is there emotion that's here? Take another breath and proceed. And then just notice the consequence of having stopped and paused, right? The autopilot of busyness, and to see the consequences of that. Or the 3-minute breathing space, which is a commonly used micro practice of taking 1 minute to just observe in the same way I just described. 1 minute to feel the breath, 1 minute to feel the sensations in the body, and then just proceed. Or a soles of the feet practice of bringing awareness to the bodily sensations that are present in the feet, or engaging in a 3-minute or 5-minute body scan of awareness of bodily experience, and then noticing the consequences of having paused and returned the awareness away from all the narratives and judgments and criticisms to just the bodily experience that's here now. Here now. There are loving kindness micro practices, like the just like me practice, when you're just standing in line, just like me. Everyone here wants to have a peaceful day and get home safely at the end of the day, right? To foster those skills of connection, or looking for good intentions, right? Really noticing the good intentions of others that are happening around us all the time, right? Someone's carrying a package or opening a door or saying a kind word to somebody. And then the self-compassion break, which is a frequently used self-compassion practice. That's can be found in many self-compassion resources. Becoming aware, mindful awareness that right, one is struggling right now. This hurts. This is hard. Recognizing that this is part of life. This is right. This is how life can be sometimes. And it's not just me. I'm not alone in this. This is how life is sometimes. And then to offer ourselves some kindness, some grace, some space, right? What would I need to hear right now that would be kind? Or how would I respond to a friend? What kind of support would I offer a friend? But we turn that inwards towards ourselves. There's lots of resources that are also available for these types of programs and training, right? There are a variety of online MBSR programs that can now be found at various university-based centers for mindfulness. And a number of these university-based programs, centers for mindfulness, or medical centers will also offer adaptations of MBSR specifically for healthcare providers and healthcare professionals. There are compassion training programs that can be found at Stanford University and Emory University. And there are a number of mindful self-compassion training programs as well. There are also a lot of available free guided practices at these university-based centers for mindfulness, the Mindful Self-Compassion Organization, and the University of California, Berkeley Greater Good Science Center also offers a number of evidence-based short practices in their Greater Good in Action page. And finally, one of the more evidence-based apps that exist has been developed at the University of Wisconsin Madison Center for Healthy Minds. And the Healthy Minds app includes grounding in the skills of both attention regulation and acceptance, cultivating the skills of connection, and also exploring a bit what insight we can gain from these types, the awareness that comes from training in these types of skills, and also reflecting or connecting a bit more directly with a sense of purpose. And the Healthy Minds app has been utilized in several large research projects on burnout in both education settings and healthcare settings. So with that, I will stop there and we can take maybe some comments or some questions or even insights that people have from their own experience.
And thank you very much. There are several questions in the Q&A. You want to look at those for a moment?
Um,
Yep.
okay. If stress is a signal that something is wrong, how can mindfulness be effective rather than turning into a tool that desensitizes us to a harmful environment? That's a really, really important question. The intention of mindfulness training is actually not to further desensitize us. The invitation in deepening our capacity for both regulating our attention, but also resting in a non-reactive response to that experience, is so that we become less habitually reactive and can create a space for responding in clear, thoughtful, purposeful, helpful ways. And sometimes that response might be recognizing what's going on in a harmful environment and how do we respond to address what's going on in the environment. And to some degree, I would also say that I think this is also where the word acceptance kind of trips people up a little bit, right? Because acceptance can be construed to mean that, oh, it's just whatever, terrible things are happening and I just have to accept it. But that's not what's being invited in mindfulness training. The acceptance that's cultivated is to contact the truth of what's already happening. What's happening is that there's tension in my body. I have really judgmental thoughts about this, and there's anger and sadness that's present. That's what's here. Now, how can I respond in a way that is beneficial and helpful rather than reacting in a way that is just on automatic or out of habit? And oftentimes that habitual reactivity is what continues to heighten that downward spiral. I'm hoping that addresses that a little bit, but I want to be clear, right? That these types of interventions can be helpful to an individual um, in a may be helpful to an individual in a context that has not yet addressed, right, or is working to address the many systemic factors that play a role in this, right? But we still need ways. How can we tolerate being in this environment when we're being impacted in these ways? Um, in what ways can mindfulness-based training be integrated into the education and clinical preparation of nursing students and other healthcare trainees? Many medical systems are beginning to offer these types of programs. There are some training programs, medical school programs, that are starting to include access to mindfulness-based training. And I think we're soon moving into having enough evidence that some of this basic training, could be considered a part of the basic curriculum. So I would definitely be in support of that. Advanced courses, workshops, certification programs. I teach a graduate class on the science and practice of mindfulness, but that's a part of one of the curriculum in our college. But that course is available. I'm not familiar with whether or not there are workshops or certification programs, but that's a great idea. What role does sleep and poor nutrition? Absolutely. That is also a critical factor, right? That's part of the overall limitations that make it difficult, sometimes to utilize these types of mindfulness-based practices and mindfulness-based programs. When there is inadequate sleep and inadequate nutrition, it certainly makes it more difficult to regulate attention, even in less affective contexts. It makes it more difficult to regulate attention. So, the mindful awareness can be helpful in recognizing what's happening, and maybe being less reactive to the level of fatigue. And again, this is that interplay between the ways that where the places and the ways that these skills can be helpful and the limitations, right? Because one of the critical things to understand, of course, about mindfulness is that it's also not a panacea, right? It's not a cure-all for all things. So sometimes other medicine is needed. And I don't mean medicine in the context of pharmaceuticals. I mean, other approaches are needed to support well-being. And that includes our behavioral approaches that also play a role in burnout, right? Sleep, nutrition, water, um, uh, activity, etc. And I believe someone has answered the question about rumination, the repetitive getting caught, and replay the things we replay again and again and again. And I am not familiar with whether or not there's any data on self-compassion and disassociation. So I think I would be a bit out of my scope to respond to that question. Or perhaps Ron would have some expertise in that area.
I don't either, no.
Are there other? I don't see any other questions.
Well, Ann, thank you very much for a wonderful presentation. Thank all of you who joined us today. Um, Here's some closing remarks. That's all we have time for today. If you haven't already done so, please register your attendance using the self-check-in link posted in the chat. We have an accurate record of who attended today's webinar. We encourage you to follow the College of Health Solutions on social media. We learn more about opportunities like this one. Our Health Talk series will continue November 13th. We'll be discussing when clinicians become family caregivers. Details registration will be available at asuhealthtalks.com. Thank you again, and have a great rest of your day. And thank you, Anne. Have a great day also.
Thanks, everybody.